Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day, students. So for today's video, we will continue our discussion for the review of system. So dito sa session na ito, we will discuss the two systems, the respiratory system and your cardiovascular system. So previous na topic natin is the assessing the HEENT or the head, eyes, ears, nose, mouth, and throat. So ngayon naman is doon tayo mapunta sa ating lungs and thorax. So as you can see dito sa image na nakikita ninyo, we have the parts of your respiratory system. It includes your external nose, the nasal cavity, the pharynx, which is the upper respiratory tract, meaning sa taas banda po. And then we have, starting from the larynx, trachea, bronchi, and your lungs, it is your lower respiratory tract. So just a quick review, no? If you can still remember that your respiratory system is the one responsible for the gas exchange, no? Sila yung nakakatulong sa atin to gasp air, which has oxygen, and oxygen is very important, okay, in our body para sa ating blood circulation. And sila din yung naglalabas ng carbon dioxide sa ating katawan as a waste, no, coming from our body. So, here are some mga internal na pictures, okay, for the anatomy ng ating thorax. I will not go deeper with this one as I know that you had already discussed it in your anatomy and physiology. No? So, just to quick review lang, no? It starts with your nose, okay? The nose is the one that, saan first pumapasok yung air, no? Gina-filter out ng mga buhok ninyo sa ilong, and then tsaka siya pupunta sa ating nasal cavity, and then tsaka siya pupunta sa ating pharynx, and then going down to the lower respiratory tract sa ating larynx, kung saan yan yung ating voice box, no? And then sa trachea, our windpipe. And then papunta na siya sa ating bronchi. We have two major bronchi, okay? Itong dalawang to, and then it will branches out with different, or the bronchioles, or the yan yung mga maliliit dyan, and then here is the lung. So, if you can still remember, sa ating left lung, 2 lobes lang po, and then sa ating right lung, 3 lobes. Bakit 2 lobes nga? Because we give space for the heart, no? So, para magkaroon naman or hindi masyadong mahigpit sa bandang left part kung saan ando doon yung ating heart. So, makikita ninyo, we have the two pleura, we have visceral and parietal, at sa gitna na yan, meron tayong tinatawag na pleural fluid, okay? A fluid para ma-prevent yung pag-touch ng dalawang layer, okay, para hindi magkaroon ng injury. And at the same time, pag may mga fluid accumulation dyan, and that would be a problem, no? So, dapat maliit lang, minimal lang yung mga fluid na nandiyan dyan. Okay? So, ayan yung salaman ng ating terminal bronchiole. Okay, andyan dyan, dito na naka-attach ang ating alveoli, which is the alveoli, siya po ang responsible for the gas exchange. Okay, so we have millions of alveoli sa ating lungs, no? Na sila yung nagfi-filter out, okay, they they receive oxygen, and then they give it to the blood for blood circulation, and then i-release ang carbon dioxide papunta sa ating atmosphere. So, ayan yung mga regions na kailangan nating ma-review, no? Yung mga regions or the divisions para clear tayo, kasi in every part of your lungs, okay, iba-iba yung naririnig mong mga lung sounds dyan. Okay? Pwedeng dito sa mga daanan, okay, sa mga windpipes, daanan, or bronchioles, maririnig mo dyan, it's either crackles or wheezes, kasi if wheezes, pag nagkakaroon ng narrowing yung ating airway, crackles pag mayroong mga sputums na present sa ating airway, okay? Yung mga iba naman is we have bronchi or rales na marinig mo, iba-iba yung yung sound nila. So, it is I suggest that you research it on YouTube, anong-ano yung mga iba't ibang lung sounds para na-appreciate ninyo. Okay? So, ano yung mga kailangan nating i-assess for your thorax and lungs. The first thing that we assess or inspect is check for cramp. Cramp is a mnemonic, no? C stands for the chest. You check for the wall asymmetry. So the normal po na chest natin is adult, the thorax is oval and elliptical. Okay? So malaki, if we to compare, okay, magkapareho yung ating anterior and posterior part, no? Yung kanyang laki. Okay? Mga abnormal naman ng mga chest, we have barrel chest, okay, which is very common or one of the signs and symptoms na makikita natin sa mga patient with COPD or chronic obstructive pulmonary disease. Ang barrel chest po, it has an increased anterior-posterior diameter. Yan po yung itsura ng ating barrel chest. Parang nakabilog siya, no? Very, increase yung size ng ating anterior-posterior diameter. So we have also funnel chest or tinatawag nating pectus excavatum, the depressed lower sternum. O yan. So parang kaya nga from the word funnel we imagine na meron siyang funnel dito. No? Remember, alam niyo yung itsura ng funnel, ganyan. Okay. So yan ang ating funnel chest or pectus excavatum. We have pigeon chest or pectus carinatum, anteriorly displaced sternum. Okay. So yan, saan napunta ang sternum? Imbes na dito lang naka-flat, pumunta na umbok, no? Umumbok siya sa ating chest, lumabas. Okay, so we have thoracic kyphoscoliosis, raised shoulder and scapula. Ayan. Ito po yung kyphoscoliosis. Are you familiar? Yung scoliosis po is the S-curvature of our back or our body. So, ang nangyari sa kanila is nagkaroon pa ng kyphosis. Pag kasi sabihin natin pong kyphosis is kuba. Yung mga kuba, yun po yung itsura nila, no? So, ayan po, the normal one is magkapareho yung anterior-posterior na sizes na hindi masyadong malaki, the barrel chest. Ito po yung sinasabi kong scoliosis, the S-curvature of your back. Okay? And then we have pectus carinatum. Okay? Yung anteriorly displaced yung kanyang sternum. Pectus excavatum, the funnel chest. Okay? Lalim. Okay? And then kyphosis, ito po yung tinatawag natin kyphosis, yung kuba. Okay? So, yan po yung mga iba't ibang chest. No? So, next is for, R stands for respiratory po to ha. Respiratory rate and the pattern. Okay, so bibilangin po natin ano po yung normal na breathing pattern or rate ng ating patient. So, one respiration is equivalent of one inhalation and exhalation. That is one cycle. That's why we use the unit cycles per minute. So, the normal adult respiratory rate is nasa 12 to 20 cycles per minute. Magkaiba naman din po yung sa mga bata kasi normally sa mga bata umaabot ng 20 to 30. Okay, pag newborn pa umaabot ng 40. Okay? So, A stands for the accessory muscle used. So, ito pong accessory muscle used, nakikita po natin to sa mga patient na nahihirapan huminga. They intend to exaggerate their breathing pattern, no? Kasi they are gasping for air. That's why there are use of accessory muscle. Sa atin po, when we normally breathe, pag wala tayong problema sa ating paghinga, hindi natin masyadong nagagamit yung ating accessory muscles. While as yung mga patient natin that has difficulty of breathing, mapapansin mo talaga na exist na use yung kanyang mga accessory muscles. M stands for masses or scars. So you have to, after inspecting, you have to palpate if there's presence of masses. Okay? And then we have the paradoxical movement. Okay? So yan yung first na i-check natin, okay, or i-inspect natin. Afterwards, we have to palpate the anterior thorax. So the normal is smooth, warm, not tender in slight palpation. Abnormal po siya pag tender. Pag sabihin po nating tender, imagine that you're holding a marshmallow. Ganon, malambot siya. Okay? So, Tender, pag meron siyang abnormal na conditions such as costochondritis, rib or vertebral fractures or sore muscles caused by coughing, may bulging, may crepitus. This is crepitus. Sorry. It's C-R-E. Okay. Crepitus. Okay, yung crepitus po is a sound na parang imagine that you are, ano to, when you crumple a piece of paper, yun po yung napapalpate ninyo, no? That is abnormal po and lesions, okay? So palpate also the posterior thorax, meaning sa likod po. The normal is skin is intact, uniform temperature po coming from the front and the back. Okay, the chest wall is intact and no tenderness. Abnormal na findings, we have skin lesions, areas of hyperthermia. Kasi pag meron pong areas of hyperthermia, meaning may part of the body or lung part na siguro merong infection sa loob, that's why increase yung ating body temperature on a certain part. So that is abnormal. Okay, may lumps, bulges, areas of tenderness, and movable structures such as yung ribs ninyo. So you need to check. Remember that we have the true ribs, meaning pag true ribs po, it is attached to the sternum. We have also false ribs, na yan yung nagahang lang, na hindi po siya attached sa ating sternum. So afterwards, you palpate also the posterior chest respiratory excursion. Ito po yan siya. So, ang pagtuturo po dito is you instruct the patient to inhale and exhale. So, while inhaling, chine-check nyo, yung distance ng inyong kamay. Ito po siya. Yung distance niya, if it is normal. Kasi usually, the normal is nasa 1 to 2 centimeter yung kanyang layo, no? So, the normal is full symmetric chest. Okay, ayan po. Sorry, correction. It is 1 to 2 inches, okay, or 3 to 5 centimeter. The thumb separates 3 to 5 centimeter during deep inspiration. Again po, during inspiration or inhalation of your patient. Abnormal po siya pag asymmetric or medyo malayo yung distance ng thumb ninyo, no? Meaning, it's either decreased ang kanyang chest expansion or hindi po maganda yung kanyang pag-expand ng kanyang chest. Okay? And then afterwards, you palpate and auscultate the chest for vocal or tactile fremitus. Okay? Ito yung para ma-execute to by palpating, no? We ask the patient with your palm, okay? We ask the patient to mention the word 99. 99, 99, 99, 99. So, we will start with tactile fremitus, and then we will go to, after palpating, we will go to auscultating. Okay? So, we will start here. Ito po yung pagkakasunod niya. A, B, okay, C, D, and then E. The same din po, ganyan po din yung area ng ating pag-o-auscultate. And then, ito po ay sa front, ito po yung sa likod. Okay. So, ayan po. And then, the normal, it has equal vibration. Both the left and the right has equal vibration. Mga abnormal naman po, sorry, the bronchophony. Okay, ito po. Paano nga again ma-execute itong tactile fremitus? We have what we call bronchophony. So, sabi natin sa patient yung word na 99. So, ang maririnig natin is more on muffled sound. Egophony, muffled sound, or E, yung yung letter E. 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 So, ganyan yung sasabihin natin. And then, we have also whispered pectoriloquy. So, pinapasabi natin sa patient yung 1, 2, 3. Almost undistinguishable na yung mga na papalpate mo na sound or vibration. And then, the abnormal, pag sa bronchophony, pag sinasabi niya yung 99, unusually loud. Pag egophony, it sounds like a letter A instead of letter E. No? And then sa whispered pectoriloquy, instead of undistinguishable siya, nagiging loud and clear siya pag merong abnormal problem yung ating patient. And then after palpating and auscultating, we will go to percussing the chest. Okay. So ito po yung the same din po kung paano kayo nagpalpate and nag-auscultate, ganun din po yung proper na way paano po mag-percuss. Okay? So ang ginagamit po natin is either direct or indirect po na pag-percuss, no? So with your pagsabihin po nating indirect with the use of your non-dominant hand, okay, doon mo sina-strike yung inyong dominant hand para magkaroon ng illicit na sound. Okay, so ayan po. No? Ito yung sa harap. This is the front. This is the back. Okay? So, the normal is, ito po yun siya. We have normal findings. Pag resonant po siya, it should be equal over the lungs. May flatness po pag meron po dito banda po sa scapula, meaning sa likod po. Dullness pag dito sa diaphragm banda and sa liver. And tympani pag nandun na kayo sa stomach. So, meaning pag marinig mo yung tympani musical-like, as you can remember, okay, sa ating first na discussion, no, yung sa ating overview na discuss doon yung mga characteristics of percussed sounds. So, the tympani is a musical-like sound na maririnig mo over the stomach. And then, abnormal po yung pagperpercuss natin if hyperresonance po siya or hyperresonant, meaning may normal po itong narinig sa mga patient with emphysema or may acute asthma. Pag naman po may dullness siya over the lungs, meaning meron pong decreased air or what we call the atelectasis pneumonia or nagkaroon na ng lung collapse. So the word po na atelectasis is lung collapse. Okay? So, for percuss, also for diaphragmatic excursion, kung kanina po is you palpate, also you measure kasi, you palpate, measure mo yung size. Ngayon, you will also percuss the diaphragmatic excursion. So, the movement of the diaphragm during maximal inspiration and expiration. So, it usually sounds from resonance to dullness. So, the normal is, again, yung excursion po natin when palpating is nasa 3 to 5 centimeter for women and 5 to 6 centimeter for men. The diaphragm is higher on the right side. No? Kasi, syempre, tatlo yung lobes doon. So, medyo mas mataas siya compare sa ating left side na 2 lobes lang ng ating lungs. So, the abnormal is restricted yung ating excursion, meaning may lung problems ang ating patient. So, after percussion, we have auscultation. So, we auscultate the chest using diaphragm of the stethoscope. So, again po, yung diaphragm, yung malaking part po ng ating stethoscope, yun po ang ginagamit natin to appreciate the loud sounds of our lungs. Okay? So, normal po, ito po yung mga klase ng normal kung saan natin maririnig. Pag tracheal po, it is a harsh, high-pitched. It is usually heard over the trachea. Pag bronchial po, it is loud and high-pitched above the clavicles on each side of the sternum. So, pag bronchovesicular po, medium in loudness and pitch next to the sternum between the scapulae. Pag vesicular po, sa baba siya banda on the remainder of the lungs. It is soft and low pitch. So, ito naman po yung mga abnormal lung sounds. Okay, from the word abnormal, hindi po to maririnig sa mga normal na pasyente na walang problema sa lungs. So we have fine crackles or what we call the rails. It is soft, high-pitched, or a cracking or a popping sound. Ang coarse crackles, ito yung parang bubbling or gurgling. Parang yung pag nagagargle ka, yan po yung sound ng ating coarse crackles. It is loud and low-pitched. Wheezes naman po, it is a musical high-pitch or a whistling sound. Yung parang hinihika yung mga, if meron kayong napansin or meron kayong naging patient na hinihika, yun po yung sound niya kasi nagkakaroon ng constriction yung ating airway. We have also rhonchi, a musical low-pitched, parang nagsusnore lang or yung moaning sounds. And we have also friction rub, a low-pitched or it is a creaking sound. You imagine yung pintuan na matagal nang hindi nabuksan tapos pagbubuksan mo siya, yung parang king, di ba? Yung parang ganun na sound, nagka-creak siya. Okay? So, for inspecting naman po, okay, we have breathing pattern. So, 'di ba na-mention natin in inspecting kasama po yung respiratory rate and the breathing pattern. So, careful po tayo sa pagkuha ng respiratory rate and the breathing pattern of our patient. Do not tell them as they will be conscious of their breathing pattern or paano sila huminga. Siguro naman napapansin niyo yan na pag during the topic na pag dinidiscuss na yung paghinga, nagiging conscious ka how you breathe. Binibilang mo din siya. So, nagkakaroon ng changes kasi somewhat ang breathing kasi is it can be voluntary. You can stop breathing consciously ha. So, that's why pag nag-assess ka ng breathing pattern, wag na wag mong ipapakita sa iyong patient para hindi sila ma-conscious at maiba yung kanilang breathing pattern. So, you inspect for the respiratory rate and rhythm. Pag sabihin po nating rate, meaning po nun is yung kanyang bilis no ng paghinga. The rhythm po is eto siya, ma-appreciate po natin siya pag yung ating patient is naka-attach sa cardiac monitor. Kasi doon po natin ma-appreciate din po yung ating respiratory rhythm. Katulad lang po ng ECG na gumaganon, okay, yung ating heart, ganun din po yung chine-check natin if may normal rhythm pa yung patient or wala. Okay? So, the normal breathing pattern is normal breathing or the effortless respiration. What we call medically is eupnea. Pag abnormal naman po, bradypnea is lower than normal. Okay, so meaning, meron po siyang respiratory rate na below 12 cycles per minute. Tachypnea is rapid shallow breathing. So, pag we use the term brady and tachypnea, okay, specifically itong brady-tachy, to explain na pag brady, pag nakatouch po yung word na brady, meaning slower or mababa. And then pag takip niya, mabilis or mataas siya. Okay? Pag apnea naman, it is the absence of breathing or period of cessation. So, syempre, itong mga apnea na ito na to sa mga pasyenteng namatay na, no? So, hyperpnea, it is a deep, fast breathing. So, we have what we call also Cosmos respiration. So, it has, or patient has severe rapid deep breathing without cessation. Or yan yung tinatawag nating labored breathing. Okay? Yung mga nahirapan. Or, if nag-exercise ka, di ba, parang naghihingalo ka kasi pagod ka, ganun yung ating Cosmos respiration. We have Kind-Stokes, progressively increasing respiration with period of apnea. Okay, yung mabilis, and then magsa-stop ka na mag-breathe. And then, continue ka na naman na mag-increase na naman yung respiration mo. That is your Kind-Stokes. And then, we have Biot's respiration, rapid, deep breathing with abrupt pause between each breath. So, example, ganun po yung sound ng ating Biot's respiration. Okay? So I think that ends the discussion for the assessing the thorax, lung, and lungs. Again, you will start inspecting the cramp, okay, the chest, the symmetry of your chest, the respiratory rate and rhythm, which is ito po yan siya. Okay, we have to assess the use of accessory muscles. Okay, we have M, the use, sorry, sorry. Okay, so we have M stands for your what do you call this? Masses or scars, and P stands for the paradoxical movement of the chest. If sabay po yung inyong left and right chest in breathing in and breathing out. Okay? So, yan. Uh, uh, ano to? Bloopers muna before we go to discussion of your cardiovascular system. So, may mga na-prepare lang ng mga somewhat pictures, no? If only we are in face-to-face setup, no? So, I wish I could take my family to work so they could see why I'm such a bitch when I get home. Kasi pagod ka, darating ka sa parang doon mo sa kanila nabubunton yung stress mo galing work. But then again, masama po yun. So you are not studying to pass an exam. Always remember this, student. No, students, you are not studying to pass an exam. Hindi po para lang sa prelim, midterm, semifinals niyo po, but you are studying for the day when you are the only thing between your patient and the grave, no? Ganun ka dun yun na-appreciate yung existence ng nurse pag yung pasyente ninyo is naghihingalo na and you are the one who is there at their side, no? Especially sa mga pasyente na iniwan na ng pamilya nila, no? So, always remember na yung nursing po, hindi po basta-basta yan na, okay, papasa ko ng board exam, no? Because meron po tayong application and we handle lives. We cannot really handle lives easily na anytime, ay, kahit mamatay yung patient, okay lang, pwede ko naman siyang ibalik. No, there's no return. Walang no return, no exchange policy dito sa atin. Hindi yung ibabalik mo and then in exchange sa kanyang buhay, ikaw, yung buhay mo, hindi po ganun yung nangyayari. So that's why you have to be careful. You have to learn what is the basic foundation of nursing. Kasi without knowing the basic foundation of nursing, mahihirapan kayo as you go along with your journey sa pagiging nurse. Okay? So when you finish a test that the other class hasn't taken, oh grabe yung interview, ano yung lumabas, ganito, ganyan. So nurses are like icebergs. At any one time, you are only seeing about 1/5 of what they actually doing. This is really true. No? Hindi nasasabi or hindi nakikita ng lahat ng tao kung gaano ka-important yung existence natin and at the same time, ano yung talaga yung naibibigay nating services sa ating mga pasyente kasi they're just looking at kung ano lang yung hindi nila na-appreciate yung pagbibigay natin ng medications kasi this part of our routine care eh. Okay? Giving medications, tayo yung nagpa-follow up ng mga orders ng doctors, nagpa-follow up sa mga laboratories, ano yung result ni ganito, dapat na-update natin yung doctor, at the same time, na-update din natin yung mga significant others ng ating patient. We are the one explaining them ano yung mga queries nila. Hindi nila yung na-appreciate because they take us for granted. Yun yung unfortunate na cases natin dito sa ating environment. That's why mahal na mahal tayo sa ibang bansa pero dito sa ating sariling bansa, we are underrated, no? That is the sad reality. Okay. So now let's go to the assessing the cardiovascular system. So, na-discuss na natin yung ating respiratory system. So, respiratory system, again, it is responsible for your gas exchange. Okay? The breathing pattern, okay, kaya tayo nakakahinga, kaya tayo nakakuha ng oxygen, it's because of your, ano to, respiratory system. However, ang partner ng ating respiratory system para ma-distribute ang oxygen all throughout our body is our cardiovascular system. So from the word cardio, meaning your heart, and vascular is your blood vessels, the arteries, the veins, and the capillaries. Okay, so review your cardiac conduction. So the electrical impulses from the heart muscle cause your heart to beat or to contract, no? So, if you can still remember sa inyong anatomy and physiology, na-discuss paano nagkakaroon ng um, contraction yung ating heart. So, baka sabihin nyo, meron bang electricity? Yes, meron pong electrical impulses po ang ating heart. Kaya nga po siya nagko-contract. So, this electrical signal begins in the SA node or ating sinoatrial node. Papunta, okay, it is located at the top right chamber of your right atrium. So, it is also called as your natural pacemaker. That's why, if yung ating mga patient nagkakaroon ng heart problem, nagkakaroon ng problem with the beating, okay, contraction of the heart, di ba nag-attach tayo ng pacemaker to improve their beating, to improve the electrical system of the heart. So, ito yung natural pacemaker natin. Kung wala ang ating SA node, hindi nagsastart mag-beat ang ating puso. Okay? So, review lang ha. Hindi yan siya more on hindi ko na i-discuss pa further. Okay, for the circulation, okay, the cardiac cycle, okay, we need to know our atrial systole, the ventricular systole, and the diastole. So, familiar kayo with your systolic and diastolic blood pressure. Pag sabihin po natin systolic, it is the contraction, no? Ng ating blood vessels, ganun din, paano nagko-contract. It is the timing na nag-contract yung ating heart and then yung blood pumunta, dumaloy sa ating blood vessels. Pag sabihin po natin diastole or diastolic pressure, yun po yung pag-relax naman ng ating heart. Tapos, para babalik na naman yung ating dugo papunta sa heart. Okay? Pag kasi mag-contract, pag nag-contract yung ating heart, pinapalabas niya yung, nagbubuga siya ng blood papunta sa iba't ibang parte ng katawan. Pag nag-relax yan siya, yun na yung time na nagre-receive na naman siya ng blood. Papunta na naman, babalik sa kanyang heart para naman ipapump niya ulit. So, it's a cycle, paulit-ulit, bumabalik-balik yan siya. It will start with atrial systole from the word atrium, yung dalawang atrium po natin, right and left atrium. Okay? Nagko-contract yan siya and then they will go to ventricular, sa baba ng ating ventricles. Okay? Sa ating, ito yung atrium, sa baba niya is the ventricles. So, nagkakaroon ng contraction din niya kasi syempre mag-o-open. I-receive nila yung blood coming from the atrium and then tsaka magkakaroon ng diastole which is nagre-relax na yung ating atrium at ang ating ventricles. Okay, for the peripheral vascular system, so a review, arteries carries blood away from the heart. They carry oxygen-rich blood from the heart throughout the rest of the body. But be careful, meron po tayong tinatawag na pulmonary artery. Okay, si pulmonary artery po, hindi po nila dinadala is oxygenated. They carry deoxygenated blood or unoxygenated blood galing po sa ating heart papunta po sa ating lungs. And then, si pulmonary vein po ang magdadala ng ating oxygenated blood papunta naman balik sa ating heart para ma-pump out all throughout the body. We have also capillaries. It is responsible for the exchange of fluid, nutrients, and metabolic waste between the blood and the cells. Usually, partner po ng ating capillaries is nasa lymphatic system. Okay, veins, they carry blood towards the heart. Okay, they carry oxygen depleted or mga deoxygenated or kulang. It's either walang oxygen or kulang ng oxygen. Okay, so what are the things that we need to assess for our patient when sa ating cardiovascular system? Okay, the first is we assess for the general appearance ng ating patient. Pag kasi may problem sa ating weight, okay, pwede kasi na kaya ma-increase yung weight or nagkaroon ng changes ang ating patient sa weight kasi baka merong namaga sa parte ng kanyang katawan. Okay? Pag kasi may mga edema, somewhat we question the circulation of our blood, if it is good or not, no? Example lang natin sa mga buntis, 'di ba? Tumataba sila at the same time pag lumalaki yung tiyan nila, okay? Nagkakaroon sila ng edema kasi hindi maganda yung circulation ng ating blood, nagsa-stuck yung kanyang tubig. That's why namamaga yung kanilang mga paa, okay, yung mga kanilang kamay, no? So, kasi hindi maganda masyado yung circulation because merong nakaharang yung lumalaki na kasi yung uterus, okay? So, you check for the consciousness of your patient. Kasi kung walang malay automatically, baka may problem naman sa puso. We have skin color. Okay, pag may mga changes. So, dun sa ating integumentary system, no, na-discuss natin yung mga iba't ibang skin color changes such as cyanosis. Okay, so, very evident po yung pag may cyanosis or pallor, meaning meron pong decreased cardiac output ang ating patient kaya namutla siya to the point na nakulangan na siya ng oxygen. No, we have skin temperature. Pag malamig yung temperature ng ating patient, meaning walang enough na blood na susupply or nagsisirculate sa kanyang katawan. Because kaya tayo mainit because of the blood that is circulating in our body. Okay? Kaya nga 'di ba, mapapansin niyo pag namatay yung ating patient, lumalamig yung kanilang katawan because hindi na circulate yung dugo sa ating katawan. So you have to check for the skin turgor. So if you can still remember sa ating assessing integumentary, paano ina-assess yung skin turgor? You pinch a skin, and then if bumalik siya, meaning the patient has good skin turgor. We have also skin texture, and we also check if the fingers are clubbing or not. Kasi clubbing fingers is a sign of chronic hypoxia, meaning kulang na kulang po ng oxygen yung inyong tissues and body, which may be caused by a lengthy cardio or respiratory disorder. So remember, if the patient is dark skin, inspect his mucous membrane for pallor. Kasi hindi natin ma-appreciate po sa kanilang skin yung pamumutlak because they are dark skin patient. And then you assess for the neck vessels. So you first inspect the vessels in the patient's necks, especially yung ating jugular vein. Dapat kasi yung ating jugular vein is hindi masyadong napapansin, no? Yung dito kasi meaning may problem yung ating patient if very evident siya. So carotid artery should appear to have a brisk and localized pulsation, normally protrudes when the patient is lying down and lies flat when he stands. For palpation, to palpate the carotid artery, lightly place your fingers just the medial to the trachea below the angle of the jaw. The pulse should be regular in rhythm and have equal strength in the right and left carotid arteries. So no palpable vibration and or thrills dapat. And mind you, yung pagpalpate po ng ating carotid artery or carotid pulse, hindi po pwedeng dalawang kamay pagsabayin nyo po kasi pwede pong magkaroon ng or pwede nyo pong ma-obstruct yung blood flows papunta sa brain, so baka magkaroon po ng problem yung ating patient. And careful not to, kumaga parang yung point na parang sasakalin mo na yung patient mo. Light palpation will do, no? So next is you auscultate, you ask the patient to hold his breath, and then pakikinggan mo yung inyong neck vessels. There should be no vascular sound, and brewy sound means abnormal findings. Okay? Pag may narinig kang sound, no? Other than yung ating labdob. Okay? So, evaluating the jugular vein distension, ayan. Paano po i-evaluate? You place your patient in supine position with 45 to 90 degrees head of bed or nasa semi-Fowler's position siya. And then locate the angle of the Louis dito sa ating sternal notch. And then greater than 3 to 4 centimeter above the sternal notch indicates jugular vein distension. Pag may makita ka dito, ipaparaise mo yung head ng patient mo. If makita ka na may bulging dyan, meaning distended siya, meaning your patient has problem with your heart, no? With his heart or with her heart. Okay, so in assessing the heart, the first thing is for inspection, we inspect the chest and note for the cardiovascular landmarks. So, ayan po yung ating mga landmarks. We start with the sternoclavicular area, and then sa dalawa, we have the mitral area. Okay, we have the aortic area. Okay, ito po siya. Sternoclavicular, mitral, aortic. Okay, and then the this is aortic, this is pulmonic. Sorry, this one again. This is sternoclavicular, this is aortic, this is pulmonic, and this is mitral area. Okay, so yan po yung mga specific na areas that you need to note, and then you listen for the sound. Okay, so pero inspection pa lang yun, no? So look for pulsations, symmetry of movements, or retraction or heaves. Note the location of the apical impulse. Okay, yung ating apical pulse, it is usually be observed, no, or na-appreciate siya sa ating fifth intercostal space or mid-clavicular line. Kung dito sa mga babae, madali siyang malocate. Just below the breast of your patient, doon mo ma-appreciate yung ating apical pulse on the left part, no? Then for palpation, follow a systematic palpation sequence. You will start with sternoclavicular and then aortic and then to the pulmonic and then tricuspid or mitral and then sa epigastric areas. For percussion, we will start with anterior axillary line, sternum along the fifth intercostal space. The sound changes from resonance to dullness over the left border of the heart. So, ito po siya yung sinasabi lang asterior, ito yan. Gina-percuss natin po yan siya. Yan po yung landmarks. Okay, we have anterior axillary line, mid axillary line, and posterior axillary line. So, dyan ka nagpo-percuss. Okay? So, for auscultation, position the patient lying supine or lateral or sitting. Use a zigzag pattern over the precordium. Note for the heart rate and rhythm. So, the normal po na heart rate ng isang adult patient is 60 to 100 beats per minute. Okay, BPM. Yan po. No? So, not identify the S1 and S2. Ang normal po na sound ng heart is S1 and S2, the lub-dub. S1 is the lub and then S2 is the dub. S3 and S4, these are abnormal heart sounds na maririnig mo. Extra yan siya. Kasi it's either merong extra flapping sound yung ating mga valves. That's why meron kang S3 and S4. So, ito po yung sinasabi nating zigzag pattern. Okay? So, you will start here, aortic, and then pulmonic, herbs point, and then we have um, tricuspid area, and then your uh, mitral valve. So, ayan. Then. Okay. And then, for assessing the vascular system naman, um, for the, yun po yung sa heart, na sa cardio part. For the vascular system naman, which is to assess the arteries, the blood vessels, okay, the veins and capillaries, you inspect, the patient should have equal arm size, symmetrical legs, okay, skin color, body hair distribution, lesions, scars, clubbing, and edema of extremity. So, bakit po yung extremities yung chine-check natin? Kasi remember, dito po dito po widely distribute yung ating blood vessels. Kasi, syempre, ito po yung daanan ng ating blood circulation. So, if ever meron pong problem sa ating extremities, the left and right arm, and your left and right foot, okay, meaning may poor circulation na nangyayari. So, next, after inspection, we have palpation. Palpate for the skin temperature, the texture and turgor, assess for capillary refill. Paano po nagkakaroon ng capillary refill? You pinch, okay, hard yung nail part, and then bilangin mo kung kailan siya. Kasi, di ba, hanggang sa pumuti siya. Pag pumuti siya, and then pag tanggal mo nung pininch mo na area, pag bumalik yung pagiging red niya, 2 to 3 seconds, that's normal. Pag more than 3 seconds, that's abnormal. So, merong poor circulation yung inyong patient. So, palpate the arms and legs for edema. Palpate arterial pulses or yung ating mga pulse. If you can still remember, we have the carotid, the brachial, the radial, the femoral, popliteal, posterior tibial, dorsalis pedis. We have also ulnar pulse and also the apical pulse. So, grading pulses. So, paano po natin i-grade yung ating pulses? So, 4 positive pag bounding po, meaning sobrang lakas. 3 positive pag increase po yung napapalpate ninyo na pulse. 2 positive pag normal po siya. Pag 1 positive naman kung very weak. Kasi may mga patient na very weak. Kaya nga paminsan, di ba, pag nagbibipi tayo, nahirapan tayo sa pagpapalpate ng kanilang brachial artery or brachial pulse kasi may mga patient na weak yung kanilang mga pulses. Okay? And then 0 pag absent naman. Pero mind you that weak na pulse is meron din siyang meaning. So, pag very weak siya, baka hindi maganda yung daloy ng blood circulation. That's why weak din yung pulse. Okay? For auscultation using the bell. Bell po, kung sa ating assessing the chest, thorax, or lungs, ginagamit natin is diaphragm. Sa pag-assess po ng ating or pag-auscultate ng ating heart sound, we use bell kasi more concentrated siya at saka deeper pa yung pinapakinggan natin na organ. We follow the palpation this is palpation. yung zigzag pattern. Okay? You follow that pattern or sequence. Okay? And then assess for abdominal aneurysm or brewy sound. Pag meron, again po, pag may brewy sound na naman po, meaning may problem yung ating patient. So ito po yung mga abnormal findings na pwede nating mapansin if ever the patient has problems sa cardiovascular system. So the skin color of your patient is pallor or cyanosis. Again, pallor and cyanosis may indicate a poor cardiac output and tissue perfusion. Pag edema naman, you identify if it is pitting or non-pitting. Pag pitting po, it causes an indentation. No? Nagkakaroon ng indention. Pag non-pitting po siya, wala pong indentation. The skin feels unusually tight, pero pag i-pinch mo yan siya, hindi nagkakaroon ng indentation. So, if you can still remember yung sa assessing the integument, andun yung ating picture, no? Yung grading na 1 positive, 2 positive, 3 positive, and 4 positive. So, mga abnormal pulsation na pwede nating marinig, no? Pag displaced apical impulse or for example, imbes dapat sa left side, sa fifth intercostal space mo maririnig, okay? Yung apical pulse, pero hindi siya doon na-appreciate. So, baka merong heart failure patient or hypertension. HPN po, that is hypertension. Ito po, hypertension. Forced apical impulse, increase yung cardiac output. Pag, iba pag, di ba, the times na we do so much activity, masyadong mabilis yung pagtibok ng ating puso at masyadong malakas yung ating, pwedeng magkaroon ng sobrang lakas na impulse. So, it can be caused by increased cardiac output na dumadaloy, no? Aortic, pulmonic, or tricuspid pulsation, meaning meron po kayong, if ever meron po kayo narinig na mga abnormal pulsation dyan sa aortic, pulmonic, and tricuspid, meaning may heart enlargement. Epigastric palpation, merong heart failure or aortic aneurysm. Sternoclavicular pulsation, maaari pong ang patient inyo is merong aortic aneurysm. Merong slight left and right sternal pulsation. It's either merong anemia yung patient mo or anxiety, or if meron kang narinig na or napalpate na sternal border heave, that is ventricular aneurysm. Okay? So I think that ends my discussion for the assessing the cardiovascular system. So, i-end ko yung video na to with this two discussion of major body systems, the respiratory system and your cardiovascular system. So, if you have questions, clarifications with regards to topics that I have discussed, you can PM me or you just comment it here dito sa ating video link. Again, thank you for watching and I hope you learn a lot today. Wassalam.